Give me vision to see things like you do. God, I look to you. You're where my help comes from. Give me wisdom. You know just what to do. I will love you, Lord, my strength. I will love you, Lord, my shield. And I will love you, Lord, my rock. Forever all my days, I will look to you, God. We trust you. This is your we trust you, God. Come on, let's sing this together. Sing hallelujah. With everything inside of me, yeah, I raise a hallelujah, and I will watch the darkness flee. I raise a hallelujah in the middle of the mystery. I raise a fear you've lost your hold on me.
All right. Well, good afternoon, everyone. Just want to take some time out to thank you for watching us, for supporting us, for sharing our broadcast. Thank you for commenting. God has so connected us on this social media platform, and we are so thankful for you. And we are thankful that you have decided to join us here on today. Of course, we like to welcome all of you who are watching on Facebook, on Twitter, on YouTube, on Instagram. If you are watching through the My Sunday app, we would like to thank you and welcome you as well. Listen, if you don't have our church's app, make sure you go to your app store, download My Sunday, do a search for Birmingham Bible Church, and you can watch all of the broadcasts right there from the app. And so we thank you for doing that. Welcome to Birmingham Bible Church's Winning Wednesday. That's right, where all of us are winners. Even if you don't feel like a winner on today, hopefully you will feel like one after this broadcast. So y'all know how we do it. Please do us a favor. Make sure you tag somebody in this broadcast. Go to the comment section, especially if you're on Facebook. Find the @ sign, put somebody's Facebook name on there. Text some people. Share this with some people because today is a new month. It is the month of May. This is, I believe, the third. I think it's the third, it's May the 3rd, I believe. And so we have a new lineup, we have new information. And so we are excited about what's going to go down on today. Today, we are going to be talking about cancer awareness, cancer awareness. Did you know that there, and I didn't realize this, so I had to Google it. I was wondering how many different types of cancers there are. And so there are over 100. That's a lot. And I know it's based on the location of the cancer. So if it's in your lungs, it's lung cancer and what have you. And of course, we can't begin to talk about each and every one of them, not on today, but this Winning Wednesday is designed to just encourage you to get screened, to get tested, to know your risk, to know the dangers, and to know the stats. And so we're having this because I believe in some way all of us have been impacted by cancer. Either it's yourself personally, maybe it's someone that you know, maybe it's a family member, you know, a friend, a coworker. But today we want to give you some vital information on this topic. We want you to create some wins in your health. And so on today, we have with us Derrick Flowers. He has been with us before. I'm excited. This is probably his third time being here with us, but he is with the UAB, the University of Alabama in Birmingham. He's going to introduce himself a little bit more, but he works with the O'Neal Comprehensive Cancer Center. A lot of y'all know Rochelle Wallace, and she has always done a great job with this. And so he works with her. And so I am so happy to have Derrick with us on today, and he is going to tell us about cancer awareness and what we need to do to be aware of this disease. So, hey, Derrick, how are you?
Good morning, Lady Pam. Doing well. Thank you so much for inviting me to participate in this today.
Oh, definitely. Thank you for joining us. Thank you. You always do a wonderful job at explaining things, and so we're excited that you're going to share this information, and then also share at the end how people can contact you if need be. So, yes. So tell us. First of all, tell us where you work. Tell us what you do, and you can. I'm sure that may be in your presentation. Not sure, but and then you can go forth in your presentation.
No, you're perfectly fine. Thank you so much for the chance to introduce myself as well. Hello, everyone. Derrick Flowers Jr. here from the O'Neal Comprehensive Cancer Center. It is my pleasure to serve Jefferson County as your program coordinator for the Cancer Center. My efforts specifically for the office is to share cancer education and prevention information, especially to our underserved communities who don't know what access they have to certain services, who don't know what cancer is, and even more so, they don't know that they actually have a strong chance of fighting against cancer. So it's our knowledge to go out there and dispel, the misinformation and the ignorance that we even have in our community, because we simply don't know things. So we're going to address that by tackling it head on, going to talk to our community, neighbors, friends, you name it. We're talking to somebody, whoever will listen to us, so we can get this knowledge out there for the betterment of our lovers, of our loved ones and brothers and sisters.
Amen. That's awesome. Well, you're doing a wonderful work. It is so needed. And so we hope our viewers really take the time out to really get this information and just share it, share it with someone who, they got the diagnosis and, they just don't know what to do, or they just may be doing the wrong thing. So we are so excited that you're bringing this on for us today.
Thank you so much. So may we get started?
Yes, that's fine. I'm ready.
All right. So we're going to tackle cancer awareness, and we're going to go ahead and call it 101, because we realize that, the basics that may be familiar to me because I work in the field are not understood basics to the general public. So what we do is we actively compile this information and present it in a way to where the average person can understand. No matter what your field of expertise may be, this material is designed for everyone to understand it and get something from it that they can take back to others as well. So we're going to go ahead and get started. These are going to be the what you need to know facts. All right. So to start us off, we're talking about cancer. So what is cancer? Cancer is the general term that describes an overgrowth of abnormal cells. Can occur in any organ or tissue in the body. And there are actually more than 200 different types of cancer, because it can affect so many different areas of the body. To that growth, the normal cells that we have in our body is made up of cells. That's what we are. And the normal cellular process knows when to stop. They split in, one cell splits into two and so on, and they know when the job is complete. Unfortunately, with cancer cells lose the ability to know when to stop reproducing. And those masses cause issues in our bodies because it throws off the cellular process as well as normal body functions as well. So examples of normal cellular reproduction, you see it on yourself all the time. You ever bit your tongue or bit the side of your mouth while you're eating on some good food, or scrape your knee, or even if you're going through natural processes, or when you're experiencing childbirth, you know that the child starts off in small cells and becomes a living organism. That is actual natural cellular growth. So we have to stop this issue of getting cancer cells to stop growing, possibly remove the cancer or shrink it down to something, whatever we can do to get things back to normal so the body can live. Cancer cells, furthermore on that. So tumors are a mass of those overgrown cells that we just discussed. Tumors can either be benign or malignant. Benign means not cancerous, meaning, yes, you can have a tumor or some type of mass in your body, but it does not mean that it's cancerous. Malignant, unfortunately, means that something is cancerous, that tumor there. So what are the dangers of these tumors? The tumors, when those cells begin to collect in one or several spaces, the danger of that is that they can go through a process called metastasis. And that is the spread of cancer cells to different areas of the body by way of the lymph system or the bloodstream. So how do we test whether or not a tumor is benign, non-cancerous, or malignant, cancerous? A biopsy is one of those ways, and that is by taking a small tissue sample to look at the cells up close after screening to see if they are cancerous. So at the O'Neal Comprehensive Cancer Center, our top 5 specific cancers that we focus on are lung, breast, cervical, prostate, colorectal. And the reason why those are our top 5, now we recently added, of course, 2 others. We look at multiple myeloma and brain tumors as well. But with these top 5 cancers that we have here, the reasons why we go after those is because there is a high incidence rates number, and that means a number of new cases, and mortality, number of deaths in these types of cancers for the state of Alabama. We have entirely too many different cases going on, and it raises concerns of what we're doing in our communities. What doesn't the average citizen know that is putting them at risk of developing cancer. That's one of our reasons that we're going after these top 5, because those numbers are entirely too high. Also, there's a clear message about who should be screened and what screening and treatment options are available. Now, one of the main things that we try to teach in the community is not everyone will not experience the same process when it comes down to cancer and treatment as well. No one case is exactly the same as the other. So what we do is we tell everyone, if you think you are at risk, or if it's time for you to get those certain screenings done, go, and be on time with it. Be proactive about your health and know your status long before the symptoms start to develop. No, we don't want you to wait until you start feeling bad. No, we don't want you to wait till you see some things changing your body that are unfavorable. No, we don't want you to wait until you can't do your normal functions like you used to. We want you to know your status long ahead of time, because if you know it sooner, your chances of survival and long lasting life are much, much greater. Also, we study these, we go further with these 5 specific cancers because they disproportionately affect people who are African American. So people who look like me, who look like Lady Pam, of course, too many of us are experiencing cancers in a very stunning rate where we should not be seeing those numbers. So we go out here in these communities and we address these top 5. So later on in this presentation, we're going to cover each of these cancers very briefly to tell you what they are, what you need to look for as possible symptoms of these diseases, what prevention methods that are available to you, and of course, what treatment options are also available to you as well. So the first one, lung cancer. Why lung cancer? Lung cancer is a type of cancer that, of course, begins in the lungs. There are 2 main types of lung cancer. We have non-small cellular lung cancer, and then we have small lung cancer, the adenocarcinoma cancer as well. So why is lung cancer the first on our list, you may want to ask? Lung cancer is the #1 killing cancer here in America, especially for our citizens who look like us. Lung cancer is the #1 cancer killing agent here in the States. How common is it? It's the second most common cancer diagnosed in both men and women. It's the leading cause of cancer death among both men and women in the US. Account for 1 in 4, 25% of all cancer diagnoses and deaths each year. Isn't that amazing? Look at these numbers here from just 2019. 116,440 men, 111,710 women. Wow, that's just new cases. As for deaths back in 2019, look at this, 76,650 men, 66,020 women. Those numbers are very, very stunning. So what risk factors do we look for when we talk about lung cancer? People who are older age, there's a specific window that we look for because cancer in itself is what we call a disease of aging. As we get older, of course, certain things in our bodies change, and cancer, unfortunately, is one of those things that can develop from those changes that we go through in our body as we get older. Balances just get thrown off a little bit. So age is a factor. Men are more likely to be at risk of developing lung cancer. We talked about the African American population having a long history of smoking cigarettes. Yes, we're going to cover talking about cigarettes. And of course, having a lower socioeconomic status. And there are many things that we can throw into that bucket, but the #1 concern for us is the lack of access to healthcare. People just don't know what services are available, and much less do people have certain services available to them. Additional risk factors for developing lung cancer: exposure to radon, secondhand smoke, radiation exposure, work exposure, air pollution, dietary factors, lack of physical activity, family history. It is important to know your family history, especially in regards to cancer. That way you'll know what signs and what symptoms to look out for and know what you need to look ahead of, and not when those symptoms become apparent in your daily life.
Hey, Derrick, I had a question about risk factors, and I know
Sure.
there's probably not enough studies on this, but
Mhm.
vaping,
Mhm.
we have a lot of people that's vaping or the electronic cigarettes. Any studies on that that's come out as far as a risk factor?
There have been several studies that come out, but as far as what we uh, target here at O'Neill, we haven't been given our directive yet on what to say on those matters for our
Okay.
own purpose, our own studies, but we want people to be aware of any foreign thing that we put inside of our bodies. The
Mhm.
same question has been raised, of course, with marijuana usage as well. So
Right.
we let people know, like, even though there are some debating or conflicting reports back and forth about, whether we should or whether we should not. The most important thing we have to realize is when we put any type of foreign substance into our body outside, of course, natural food, not the processed stuff and water, we realize that it will have an effect on our bodies. So
Oh,
each individual may have maybe more susceptible and want to watch that a little bit more carefully than the average person. So we put that on the individual to go back and do what's comfortable for them and what their physician suggests.
okay. All right. Thank
Mm-hmm. Yes, ma'am. All right. So, what symptoms would you look for in regards to lung cancer? Coughing. The most common, 50% of cases, is just a cough that develops, and people don't think much of it until here comes number two: blood in the phlegm comes into play. Shortness of breath, wheezing, pain in the chest, fatigue, pneumonia can even develop. And remember, you can or may be at risk of cancer still, regardless of not if you are showing symptoms. That is why if you're in that age bracket where it's actually where you start at age 50 on up to age 80, really was the screening window allowed for cancer. You can go ahead and start getting checked out, especially if you're high risk and you have a long smoking history. We're about to talk about that soon. So these are the symptoms that could be linked to lung cancer. However, remember that symptoms are not always the signs you want to wait for to get diagnosed. Be proactive about your health and know your status long before any symptoms will develop. Okay. So, how can you reduce your risk for lung cancer? Avoid tobacco. If you smoke, quit. If you don't smoke, do not start. Avoid secondhand smoke. Test for radon, that's natural occurring odorless gas. Protect yourself when working around asbestos, naturally occurring minerals, often found in mines, mills, textile plants, places where insulation is used. It's actually becoming less, uh, slightly less of a concern because there's new operations where there's actually foam being used as insulation material. So we're hoping that that catches on even more and people don't have to rely on asbestos unless, of course, you're using in maybe an older building or something that you want to get inspected and checked out. So screening and early detection for lung cancer. Currently, those at highest risk for lung cancer are eligible for low dose computed tomography scan. We like to see just low dose CT scan. It's very similar to getting an X-ray done. There's no blood work needed, no pill to take, no injections. You show up for your appointment. Once you're called to the back, you should be done in maybe 5-10 minutes tops. After you get the test done, your doctor will get the results and have a phone conversation with you or in person maybe to discuss any findings if there were some, and then you'll be able to have an action plan to go from there. So if you may be high risk, if you are again above the age of 50, either a current smoker or you quit within less than 15 years ago. And if you have a 30 pack year smoking history. Now, what is a pack year? Pack year is simply here broken down for us. If you started smoking, years back and you smoked one pack a day for say 30 years, for that amount of time, that's called a 30 pack year history. You are at high risk for developing lung cancer. This next one, of course, is just to show the numbers. We hope no one is smoking two packs of cigarettes per day. But again, just to show the severity of it, if you were an individual who smoked 2 packs of cigarettes daily for 18 years, that puts you at a 36-year pack history. And yes, you are at high risk for developing lung cancer. So these are the 3 things that you're looking for. If you're over the age of 50, you're eligible to get scanned. If you're a current or smoker within the past 15 years, and if you have a high pack year of smoking history. Okay, for people most at risk for developing lung cancer, a yearly scan should be done until they are no longer eligible. And generally, doctors, physicians would like to cut you off at the age of 80 years old for this process. Lung cancer screening is covered by most insurance plans, Medicaid and Medicare, as long as you are considered high risk. And I always tell people, yes, if you want our help, please get in contact with me. I'll be glad to get on the phone with you and still keep you in the loop on how to get to these appointments and what you're asking for. I actually still have a few spots open for a project where you're eligible to receive a $50 gas card from me if you let me help you get scanned for lung cancer. I'll give you my contact information at the end. I'll go ahead and say it now just in case you want it. My email address is flowersd@uab.edu. Again, my name is Derrick Flowers, and you can reach me by phone, 205-975-3622, and ask me about our ALCASE project, our lung cancer awareness. So if you want to get scanned for lung cancer, what are the steps that you would go through? And what would you help me, Derrick, do so that I can get scanned? Well, step one is you have to have a conversation with your primary physician and get a referral to have the process done. That's step number one. Number two, patients and doctor have a shared decision-making conversation about the risk and benefits of getting this scan done. And lastly, the primary care doctor refers the patients to one of the screening centers of excellence. And there are many places you can go to have the scan done. Remember what I said earlier, no blood work, no peel, no injections, 5-10 minutes of your time once you're called to the back for the whole thing to get done. And then you'll get your results, discussed with you by patient portal, or your doctor may want to have an in-person session or phone call with you. So what treatment is there? Say if someone did get lung cancer, what treatment options do they have available with them? Of course, there's always surgery. But again, what I said earlier, no one case is exactly the same as someone else. So maybe surgery was an option for one person, but then there's also chemotherapy. Maybe that worked out for the next person. Radiation therapy, targeted therapy, use of drugs, typically pills, to narrow the focus treatment to stop the cancer from growing or spreading. And then there are also, of course, immunotherapies called immuno-oncology, or IOs. They help the body's own immune system fight against cancer. The next one, breast cancer, starts with cells in the breast begin to grow out of control. These cells usually form a tumor that can be often seen on an X-ray that's called a mammogram, or felt as a lump. The tumor is malignant cancer if the cancers grow into surrounding tissues or spread to other areas of the body. Remember, that word is called metastasis. That's when those cells infect other cells in that same area or throughout the body, because it can travel through the lymph system or the bloodstream as well. How common is breast cancer? It occurs mostly in women, but men can get breast cancer too. We have to dispel that. Most common cancer in women, no matter what race or ethnicity. 1 in 8 women will be diagnosed with breast cancer. More African-American women die from breast cancer than white women. Second most cause of death from cancer among Caucasian, African-American, Asian, Pacific Islander, and the American Indian, Alaska Native women populations. So what about it with the breast health that is connected to dealing with breast cancer itself? Women should be familiar with how their breasts normally look and feel, and report any changes to a healthcare provider right away. This is one of the most underestimated parts about this cancer, because I've always heard growing up from my parents, especially my mother, she always told me, know your body, listen to your body. And that goes with, of course, examining yourself. You should know, if you have any different marks of what something doesn't feel like, your body, you live in it. No one can tell you better about, what your body is feeling like or what certain things should feel like versus you. You live in it every day. So you have to be very cognizant of what may seem different or out of place on your body. Any breast lump or change needs to be checked by a healthcare professional to determine if it is benign. Remember that word? That was non-cancerous, or malignant cancerous, and if it might affect your future cancer risk. Remember, not all lumps are cancerous. Yes, it can be very fearful, very shocking, and produce anxiety, but that's why we have modern medicine. That's why it pushes through, so that we can have an understanding on what these cancers are and what we can do about it. We have a lot of options now. So cancer is not a death sentence. We can go ahead and do whatever we can necessary to hopefully reach to a good conclusion for, of course, the patient and their families as well. Some breast changes may not cause symptoms and may be found during a mammogram. If your symptoms or mammogram results suggest that you have a problem with your breast, your doctor will take more steps to find out what it is. Symptoms: swelling of all or part of the breast, skin irritation or dimpling, odd impressions, breast or nipple pain, nipple retraction, redness, scaly or thickening of the nipple or breast skin, nipple discharge other than breast milk. So these are things that you would look for that would give you good notice on, needing the need to have an exam to see what may be going on with your breast, okay? Risk factors associated with breast cancer: age, again, remember, cancer itself is an aging disease. Gender: mostly women deal with breast cancer, but as noted, men can get breast cancer too. Early menstruation, late menopause, certain inherited genes, family history, personal history of breast cancer, race, ethnicity. Remember what we talked about? More African American women are dying because of breast cancer than other races here in the States. Changeable risk factors that we have here, things you can actively do to reduce your risk of developing this cancer. Reduce your excess alcohol consumption. Low physical activity. These are things you need to be aware of. Using hormone therapy, obesity. These are things that could contribute to your risk of developing breast cancer. So the screening and early detection, remember we talked about knowing your body. Do a breast self-exam every month at the same time. That way you'll know if something feels different or something has changed. You should be the first person to notice, because again, this is your body. Know your body. Don't be ashamed of it. Don't be ashamed to ask questions. Ask someone, what should this feel like? What should this look like? And that'll be the first steps to knowing your status. A clinical breast exam, 21 years of age and up, every year by a nurse or doctor, is another step you can take for the screening process. Get a mammogram, starting even 40 years of age or older every year. 35 years of age, you can start sooner if you have a family history of breast cancer. So yes, if you know for a fact that you've had mother, sister, aunt, grandmother that dealt with breast cancer, you'll want to start your screening process much earlier. So by the age of 35, have that talk with your physician. If you notice any changes or any troubling issues, again, talk with your physician, because early detection saves lives. That's our goal. So what treatment options that we have? Lumpectomy, that's the removal of the tumor that may be inside of the breast. Mastectomy, surgical removal of the breast itself. Radiation therapy, chemotherapy, hormone therapy, clinical trials. There are awesome new medicines and procedures that are coming out all the time, and they need people to participate to know what these things do to certain populations, and maybe a good boost of courage for someone to know that they can be a part of something new, to help out with the fight against this specific cancer. And then, of course, there's also precision medicine, tailoring specific treatment to the unique needs of the patient and the tumor. Treatment may combine two or more methods, but again, we have to keep saying this. No one case is going to be exactly the same as someone else's. You can have your way of dealing with it, and it may differ from someone else. But the most important thing you can do is first know your status. And then you can have that conversation with your physician about what plans and steps that you need to take so that you can overcome and win the fight against this cancer. Next up, we have cervical cancer. And of course, this is cancer cells that begin in the cervix, the lining of the cervix. The cervix is the opening into the uterus or the womb of the female body. How common is it? About 13,000 new cases diagnosed each year. About 4,170 women would die from cervical cancer in 2019. Tends to occur in the midlife and most frequently diagnosed in women between the ages of 35 and 44. More than 15% of cases are found in women over 65. In the US, Hispanic women are most likely to get cervical cancer. followed by African Americans, Asians, Pacific Islanders, and whites. Risk factors for cervical cancer, the human papillomavirus, most important risk factor actually. It is transmitted sexually in most cases. HPV, the human papillomavirus, can be spread during vaginal, anal, or oral sex with someone who has the virus. This virus goes in and infects cells on the surface of the skin and those lining of the genitals, anus, mouth, and throat. Can be presented as genital warts or without symptoms, maybe years before the symptoms actually develop. So again, it's important. It's one of those things you want to know your status about. Be honest with your doctor. Let them know if you're sexually active, if you potentially have more than one partner. Have that conversation with your doctor. That is perfectly fine. Just talk with your doctor about it so that you'll know how to change up things so that you can protect yourself and know what to do in these cases. So HPV can be passed even when an infected person has no signs or symptoms. May cause cervical cancer and or other cancers of the throat, the penis, or the anus. Other risk factors, of course, smoking, weakened immune system, chlamydia infection, diet low in fruits and vegetables, long-term use of birth control pills or intrauterine devices, IUDs. Also, family history as well. Those are all the signs you want to look for as risk factors of that could affect your risk of developing this specific cancer. So the screening and early detection that we have for the fight against cervical cancer, you can get the Pap test, Pap smear to get done. Women should begin getting the Pap test at the age of 21 and have one every 3 years. For the HPV test for women over the age of 29, the HPV test should be the primary way to screen for cervical cancer. Women ages 30 to 65 should have an HPV test every 5 years. So the HPV vaccine, we're going to talk about more of this, especially with upcoming projects that we have with the Jefferson County Department of Public Health. The routine HPV vaccination for boys and girls should start at the ages 11 or 12 and can be started as early as 9 years of age. It is recommended for females ages 13 to 26, for males 13 to 21 years old who have not started the vaccines, who have started but not completed the series. Yes, there's multiple shots in those areas to become completely compliant with this vaccine. Males 22 to 26 years old may also be vaccinated. Recommended through age 26 for men who have had sex with men and for people with weakened immune systems, including people with HIV infection. They have not been previously vaccinated. So yes, again, know your status, get these vaccines in, ask questions if you want to know when your child should start and how long the whole process will last. Things to do to prevent precancers. This is associated again with that cancer. Early detection of the Pap test or the smear is key. Get the HPV vaccine. Make lifestyle changes. Delay onset of intercourse. Limit number of sex partners. Use a condom. Don't smoke. Of course, and we talk about having a healthier lifestyle with diet and exercise as well. But these are very, very, very important things to prevent precancers. What treatment options are available? Depends on the stage of treatment. Again, we talked about this earlier. You're going to hear me say this a lot because it's part of the education that we do. No one case is exactly the same. So stage of the cancer is very dependent. The type of cervical cancer, persons, if you desire to have children, then you have age to account for as well. The precancer treatment options include the LEEP test, and you have the cryotherapy, laser, and of course, colonization. Cancer treatment options, radical hysterectomy, of course, radiation, and chemoradiation. Cervical cancer can be 100% if diagnosed at an early age. It can be cured at 100% if diagnosed at an early stage. Next up, colorectal cancer. This is cancer of the colon or rectum, believed to develop gradually from polyps. Polyps are tiny growths on the inner wall of the colon or rectum. These precancerous growths may continue to grow and form a tumor. Removal of polyps can prevent colon cancer. Now, more information on polyps, because I know polyps can be a very scary thing to talk about as well. So stay with me. Here we go. The colon is part of the digestive system. The digestive system, of course, removes and processes nutrients from food. Nutrients such as vitamins, minerals, carbohydrates, fats, proteins, all that stuff is processed through our colon. So digestive system helps the body get rid of the waste material. The first 6 feet of the large intestine is the colon. The last 6 inches of the large intestine is the rectum and anal canal. What symptoms would you look for colorectal cancer? Change in bowel habits, diarrhea, constipation, narrowing of the stool that lasts more than a few days, feeling that you need to have a bowel movement that is not relieved by doing so, rectal bleeding, dark stools, or blood in the stool. Let's stop right there for a minute. Yes, you should be checking these things. Once you have a movement, it is very natural. It is very much encouraged for you to check your stool. It's not something that many people want to talk about, but it's a natural part of knowing what your body is doing. If you want to know what's going on, you watch everything that comes out as well. So that includes urine, that includes your stool. Look at these things. If something looks odd or out of place, that is a conversation you'll need to have with your doctor. There is no shame in dealing with these things. If you know something is out of place or looks out of the ordinary, please, please, please have the conversation with your doctor and let him or her know. So what else? What other symptoms could be contributed to this cancer? Cramping or abdominal belly pain. Fatigue and weakness is also another symptom. Unintended weight loss as well. So these are things you want to look out for in regards to colorectal cancer. What risk factors are associated with it? Age, most common in women, men and women over the age of 50, but it can develop sooner. If you have a family history, here goes those key words again. That's something you want to have the conversation with your doctor about. If you have a family history of this cancer or any other, know what your status is and set a plan in motion that you can keep an active watch on your body and make sure that you aren't developing any hidden problems. Inflammatory bowel disease, diets low in fiber and high in fat and calories. Yes, your diet is very important when dealing with the colorectal cancer because, again, it's talking about everything that passes through your body's system. That's what makes it so susceptible because as those things move through your body, it can potentially throw off cellular development and growth and begin to spawn cancer. Low physical activity, tobacco and alcohol use, prior cancer diagnosis, history of polyps in the colon, history of ulcerative colitis, lack of screening at the recommended age. These are all risk factors associated with colorectal cancer. Screening and early detection for this, screening should begin at age 50 and continue to age 75 each year. We actually lowered this to good news to say 40 now, actually. People at increased risk because of family history of colorectal cancer or polyps may be advised to start screening earlier or have more frequent screenings. Several screening options you have, of course, the colonoscopy, fecal occult blood test, the sigmoidoscopy. I always have trouble with this one, sigmoidoscopy, and barium enema. These are all things that we can use that your physician can use, to go in and check out what's going on with your body and see if you are developing or at risk of colorectal cancer. Screening and early detection. So the colonoscopy is a procedure to look inside the rectum and the whole colon. A colonoscope is a thin tube-like instrument with a light and lens for viewing inside the colon. You'll be put to sleep, of course, or not necessarily sleep, or maybe in a relaxed state to sedate it somewhat so that they can go in with this tube and camera to look around to see what polyps, if you do have any polyps, and if they need to remove any as well. Colonoscopy should be done every 10 years. Most effective detection. Someone needs to put their eye on it and see what's going on. Okay. All
Hey,
right. So the
Derrick,
fecal. Yes, ma'am.
one quick question. If they do detect polyps in your colon, do you need to go back sooner as opposed to every 10 years? Have they anything said about that?
Generally, if it's, with the polyps, so I'm glad this actually came up again because I was waiting for that slide to come up. Just because you have polyps doesn't mean that they may be cancers, but as far as if they are seen and your doctor sees them in from the colonoscopy results as they done the filming, the general wants you to come back somewhere in a span of 5 to 10 years, actually, because those polyps, yes, they may be there, but they're very slow growing.
Yeah,
It's something that has to progress to from the polyp to the tumor, and then of
yeah,
course that's where the cancer risk scare comes in.
gotcha. Okay.
Mhm. All right. So back with the fecal occult blood test, use a small sample of the stool and place in a special cards or in a vial. Cards are returned to the doctor or laboratory for testing. Again, nothing to be ashamed of. No one likes to talk about stool, but here we go. This is important. You have to know your status. So this is another test you would use to check your risk for colorectal cancer. Sigmoidoscopy is a procedure that looks inside the rectum and first part of the colon. A sigmoidoscope is a thin tube-like instrument with a light and lens for viewing inside the colon. Sigmoidoscope may also have a tool to remove those polyps on site as well during the examination. Sigmoidoscopes should be done every 5 years. So screening early detection, this is also going to the barium enema, a series of x-rays of the colon and rectum done every 5 years, full preparation needed for this, of course. Treatments options for colorectal cancer, surgery, radiation therapy, chemotherapy. What have I been saying for the whole presentation? No one case will always be exactly the same as another. So yes, surgery may be the option for one person, but chemotherapy may be a workable option for someone else. Treatment will depend on the stage and location of the cancer, as well as the risk and benefits associated with the treatment. Next up, prostate cancer. Cancer that forms in the prostate. The prostate is a gland about the size of a walnut. The prostate is a part of the man's reproductive system. It's an organ located in front of the rectum and under the bladder. The prostate surrounds the urethra and the tube through which is the tube through which the urine flows out of the body. So these are statistics associated with it. For 2019 alone, 174,650 men will be diagnosed with it. 31,620 men will die from prostate cancer. 1 in 5 African American men will be diagnosed with prostate cancer in their lifetime. African American men have the highest incidence rates number of new cases of prostate cancer of all races. What symptoms would you look for with prostate cancer? Urinary problems, inability to pass urine, a hard time stopping or starting urine flow, pain or burning during urination, needing to urinate often, especially at night. Those are key signs you want to look for as possible symptoms to prostate cancer. Difficulty having an erection, blood in the urine, frequent pain in the lower back, hips, and upper thighs. Again, if you're experiencing these things, it's best to know about them as possible risk factors for this cancer, because especially men, we're very easy to write things off as just getting old or having, eaten something wrong. There's a bunch of labels we can stick on things to cover up the potential bigger issues. So if you know that you're in this age gap of what we talked about, of possibly contracting this cancer, and you're feeling something that's out of place and out the ordinary, this is a conversation for you to have with your physician. Risk factors: age, family history, again, race, eating a diet high in fat or drinking alcoholic beverages. To reduce risk, one can reduce risk by making healthy choices, exercising, and eating a healthy diet of fruits and vegetables. Screen early detection for prostate cancer guidelines: age 50 for men who are average risk, age 45 for men at high risk, age 40 for men at even higher risk, those with more than one first degree relative who had prostate cancer at an early age. That can be dad, uncle, brother. Those are key signs you're looking for in your family history to know what your risk is for developing prostate cancer. Screening and early detection. early detection tools. A lot of people aren't aware of this. We actually just kind of going to the next stage of a current project where we had what 116 men participate in a survey, and they completed the survey. And then we had focus groups last week to talk to a few of those men, 2 nights each, 2 nights for two separate groups. And what we found is a lot of them still don't know, and their colleagues don't know, that there are other exams besides the digital rectal exam. That's where, of course, the doctor uses his or her fingers to go in and check the prostate. There's the PSA test, the prostate specific antigen test. It's a blood test that measures PSA in the blood. If you have an abnormal or high reading of prostate specific antigen in your blood, that is the starting line for you to healthfully consider getting the digital rectal exam, which is right up. So the digital rectal exam, men don't like talking about this, but we have to remember that our health is more important than pride. It's more important than these other things. It doesn't reduce the concern that men have in getting this test, but we have to become more educated and talk about it so that men understand that there is no shame in knowing the status of your health. So the digital rectal exam, doctor inserts a lubricated gloved finger into the rectum and feels your prostate through the rectal wall. That's the top of the line way for you to know, your potential risk and status of prostate cancer. Treatment, active surveillance or watchful waiting. Regular tests monitor the cancer. Treatment is only given if and when the prostate cancer causes symptoms and grows. Again, treatment options go into surgery, radiation therapy, hormone therapy, and cryotherapy. What have I been saying? All cases are not the same. So just because someone went through it one way, it doesn't mean that you have to as well. Screening options reviewed. So tools for early detection, low-dose CT scan for lung cancer, pap smear for cervical cancer, mammogram for breast cancer, colonoscopy for colon cancer, prostate-specific antigen, or the rectal exam for the prostate. Screening is recommended for individuals who do not show symptoms. So yes, even if when you hit those age ranges, you should be having a checklist with your doctor saying, hey, it's that time. I'm 40, I'm 50, I'm 55. It's time for me to know my status on these cancers and if we need have something that we need to be concerned about. So what can we do? We're talking about prevention, cancer awareness. Choose a healthy lifestyle. About 40% of cancer cases could be prevented each year by following diet, physical activity, and weight management recommendations, of course. Not smoking, using sun protection, using cancer preventing vaccinations are also key to lowering your cancer risk. So we're going to talk about some of these options very briefly. So nutrition, of course, we want to talk about food that you put in your body for your body to function. Consume 5 to 9 servings of fruits and vegetables each day. Plant foods should be at least 2/3 of your plate. Limit fast foods and processed foods, high in fat, starches, or sugars. Yes, it may be quick, it may be cheap in some cases, but we have to be more proactive with our health. I fortunately have been very consistent in my workout efforts. I've been going strong since August now of last year. I have a personal trainer. I've been meeting with him every week, Monday, Wednesday, Friday, 5 a.m. And that's where I get my time in. But guess what? Exercise is good, but nutrition is 80% of the battle to a healthy lifestyle. So I'm still working on this area, and I encourage you to do the same. Be active about the food that you intake into your body. So further on that list, limit your red meat and processed meat consumption as well. Consume no more than 12 to 18 ounces of cooked meat per week of red. If possible, avoid processed meats. And of course, that's that good old sandwich meat and whatever else you want to throw in there. We just need to be cautious and very proactive and mindful of the things we put in our bodies. Again, with nutrition, limit sugar sweetened drinks. That's that sweet tea. That's that Kool-Aid. That's these juices and sodas that we love so much. Work on drinking mostly water and unsweetened drinks. Limit alcohol consumption. Don't use supplements. Try to get your nutrients and the minerals that you're trying to get into your body, those vitamins, by eating your foods. Eat those foods. Mothers, breastfeed your baby if you are able to. So My Plate is another great option. ChooseMyPlate.gov. I've also had experience with using Eat This is another good app for you to use for planning out your diet. And then there's several other things you can use. These cell phones that we have, the apps that are possible for helping you plan your diet and get more menu options down. Use this technology to your advantage. Know what you can do to get more good foods into your body and on a schedule that works for you and your busy lifestyle as well. So physical activity. Regular physical activity is a key step of cancer prevention. Protects against obesity and cancer independently. Can improve the overall quality of life, reduce fatigue, and relieve depressive symptoms. Can improve cancer survivorship. Again, we talk about these treatments. We talk about these options that we go through, the surgeries and the pills and stuff and so forth. Yes, that's good and wonderful, but what is your body going to do after that trauma of the surgery, of the chemotherapy? You need a healthy body to also live after those treatments as well. So yes, it's good to have those options, but also remember your body still needs to recover, and it takes a lot to do so. So you want to have a healthy body, the most healthy body possible, so that you can also survive the treatment as well. Strive for 30 to 45 minutes of moderate intense activity daily to reduce sedentary behaviors. And what is sedentary? That means sitting too much. If you have an Apple Watch, I don't have my own right now, but mine tells me every hour it's time to stand up. It's time to stand up, especially since I work in an office setting. So whatever you need to use, Fitbit, Apple Watch, set a timer on your phone even, do whatever is necessary so that you get up and get that activity in. Again, start with just 5 minutes. No matter what you do, just start somewhere. Again, no one expects you to go out and run a marathon tomorrow. You have to start off at the pace that works for you and you alone. So whatever works for you, start small, and you'll gradually work your way up to something more rigorous and healthy for you. The best kind of physical activity is the one that you will do, and possible one that you enjoy as well. So remember, we said we're going to get to smoking. Tobacco is the leading cause of cancer worldwide, causing almost 6 million deaths per year. All these deaths could be prevented if people did not smoke. All forms of tobacco cause cancer, no matter if it is chewed, smoked, inhaled, etc. E-cigarettes, vaping don't contain tobacco, but there's not enough data yet to know the long-term impacts on the health. But again, as we discussed earlier, it's a foreign subject. Have that conversation with your doctor. Let him or her know what your habits are and set a plan in motion so that you can still enjoy life as you wish, but in the best ways possible that put you out of line for having to deal with cancer. So my contact information again, as promised, my name is Derrick Flowers Jr. I gladly serve as your program coordinator for Jefferson County in the fight against cancer. My email address is flowersd@uab.edu. And my office phone, you can reach me at 205-975-3622. Remember, if you're concerned about lung cancer, I need you to be at least age of 50 years old with a smoking history, with a very long smoking history, a 30-pack year smoking history. Call me and let me know if you're interested in my lung cancer awareness project, where participants are eligible to receive a $50 gas card for participating. I'll just simply be there to help you keep your appointments in line, and also to give you the information that you need to make sure that your insurance pays for not only the scan that you're going to receive, but also the appointment to have that conversation with your doctor. Your insurance will cover both of those, should cover both of those. So talk to me, reach out to me, and let me know what I can do for you in your communities. I'm available by Zoom, in person. Just get in contact with me, and I'll be glad to share the information that we have on cancer awareness. Again, Derrick Flowers Jr., so happy to serve you all. Thank you, Lady Pam, for having me on this morning.
Yes, I tell you what, Derek, this was awesome. I mean, a lot of information. My grandmother said the same thing. And I was well in my 40s, and she was always saying, all right, make sure you know your body. And you're
Hmm.
right, you have to pay attention to your body. You have to be proactive about your body. So even if you go to the doctor's office and if they're brushing something off, go to another doctor and get
Hmm.
a second opinion. And that's with anything. Um, the symptoms, the treatment, um, all of it was wonderful, was awesome. I am so glad. I did not plan this. So I'm so glad you ended with the nutrition,
Hmm.
because I don't know if you saw our flyer, but next week we actually
Hmm.
have a nutritionalist.
Yep,
She
I saw Dr. What was her name?
Larissa Strath.
Yeah, I
She
saw.
Yeah, she actually went to UAB. That's where she got her. I mean, that's where she went and got her doctorate. But she's going to talk about all of those cancer fighting type foods. Not to
Hmm.
say that no one shouldn't. You should get the surgery if it's recommended, the chemotherapy if it's recommended, whatever therapy the doctor is saying. Please get that by all means. But I had a conversation with a friend of mine who was just diagnosed with cancer, and I was asking her, I said, so are they telling you any foods that you need to be eating? And she said, no, not really. And I think that's key, because
Hmm.
if you're going through all of this treatment and stuff, your body needs to be well enough to handle it. I mean, I'm a strong component of that, and then also just making sure that you're healthy, period, that you're, even if nothing's wrong with you right now, let's go ahead and start getting those fruits and vegetables in. Let's make sure we're not eating or consuming as much red meat. But yes, all those are great, wonderful. That was good information. Even supplements. So we had a guy come on back in January, and he said supplement is what it says. It's supposed to supplement what you're already doing. You're not supposed to,
That
exactly.
shouldn't be your one hit.
Right, 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 right. So, no, this was great, Derek. Thank you so much. Thank you for all of your information. We have your contact. Listen, people, if you didn't catch it, reach out to us, Birmingham Bible Church, and then we can give you his information. So thankful for Derek and everything that he's doing for the community. We appreciate you. Listen, does your office also give out pamphlets or materials to organization or churches, so we can lay them on tables and so people can pick one up? And do y'all do that as well?
We certainly do. I invite any and all people to become one of my community partners and pick up this information, or if necessary, I can even mail it out as well. We can make special arrangements to do that, as often as we're allowed, so
Yeah,
that that information is available to you. So yes, literature, we have even key items that we could give out to people that has our logo so that they know who we are.
right.
And I could be glad to arrange that with you or any other church as well that wants to be more active in spreading this information to their congregations.
Good, awesome. Well, we are definitely interested. I'm gonna reach out to you in a little bit about some things that we need. So thank you so much, Derek, for that. Thank you for your availability to meet with us on today. So that's all, folks. This is another segment of our Winning Wednesday. Please make sure you reach out to Derek Flowers at UAB. Reach out to him so that you can also get this information. If you have any questions, if you're concerned about some things, he is working for the community. So thankful for that. Listen, don't forget, next week, please meet us right here. We're going to talk about cancer fighting foods. This is going to go exactly along with what Derek was talking about. So that's what we want to do on Winning Wednesdays. Want to educate you, want to empower you, want to inform you so that you can continue to live your life to the fullest, and that you can live it more abundantly. So that's all we have on today. Listen, stay tuned. We will see you guys next week. As we always like to say, make sure you stay safe. Please stay sane. Please stay sanitized. We love y'all. Till next time. Thank you so much, Derek.